Hello doctors, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. The standing hip flexor stretch is an excellent stretch to teach our patients. What we want to do is have the patient standing in good posture. We want to make sure that they are supporting themselves with a sturdy structure. It can be a chair, it can be the wall, it can be a countertop or a piece of equipment at the gym, but we want to make sure that they are supporting themselves with a sturdy structure. This way they can concentrate on the stretch instead of worrying about their balance. The first stretch I'm going to demonstrate is using the ipsilateral hand. So I'm going to hold on to the structure. I'm going to be standing up straight. I'm going to grip the ankle. We're not gripping the foot, we're gripping the ankle. And we want to make sure that the person is standing up straight. We don't want their hips to be shifting side to side or dropping in any manner. So we want the pelvis to be held level. The first thing you want to do is pull the heel towards the gluteal region and then pull the hip into extension. This is going to stretch the hip flexor muscles. We want the patient to hold a mild, comfortable stretch from 5 to 120 seconds, whatever time frame you think works best for the patients. If they cannot reach their ankle, we want to make sure that they use a towel or they use some type of exercise band to assist them with this motion. Now, once they have mastered this stretch, we can have them use the contralateral hand. Using the contralateral hand just targets the hip flexors a little bit differently, usually hits the lateral portion of the hip flexors a little bit more intensely than when we use the ipsilateral hand. So on this one, I'm going to stretch the left hand side again. I'm going to use my left hand to support myself on the chair, and I'm going to use my right hand to grab the ankle. Now this one, it's very important that the person keeps their hips level and their spine straight. We don't want them having to shift the hips or rotating the hips or tilting the pelvis. Again, if they cannot reach their ankle, they can use a towel or a resistance band. Once they have hold of the ankle, have them pull the heel towards the opposite glute and then pull the hip into extension. Hold this stretch, hold a mild, comfortable stretch in this position for 5 to 120 seconds to target the hip flexor muscles.